What we need most on the island is a return to matriarchy. The word for woman in Wampanoag is actually matamwasas, which means one with the final say. So body sovereignty is not new to us in Wampanoag community. And I think continuing the sexual wellness programming that we've started at the tribe, and that includes the fertility awareness method being taught really, really young, much younger than anything that they're doing at the high school here right now, is preparing our children to be really in touch with their bodies very early on. It's changing the stigma that we talked about here today, and it's revitalizing connection to our bodies as our cultural practice, because abortion is not just a medical decision for Wampanoag people and for a lot of Black, Brown, and Indigenous peoples. It's a cultural practice, actually, and it's sacred on our land. And so changing our mindsets around it starts with that for me. I think that's the most important thing I want to see here on the island.
I have never seen our public health infrastructure in complete obliteration like it is right now. I teach in a medical school. I'm training the next generation of public health professionals, medical students, clinicians. My students look at me with this look in their eyes and they're like, what are we going to do? We're graduating. What kind of clinical or research workforce are we going into? I have students crying in my office all the time. Two data pieces that that are particularly troubling for me. So nationally, we would collect data on PRAMs. Anybody heard of PRAMs? Pregnancy Risk Assessment, Monitoring and Surveillance System. It's a national data system. All states opt into it. It gives you baseline data on pregnancy, well-being, maternal and child health indicators. If you were to go to the CDC's website, first of all, the entire division that manages that at CDC, these are colleagues of mine, are completely, unemployed, furloughed, TBD. They're on the moon. They're not working, right? This thing has completely upended our public health infrastructure. So we have no idea what's happening nationally. Here in Massachusetts, we're still doing a pretty decent job of collecting and maintaining data. I sit on our state's MMRC, which is a Maternal Mortality Review Committee. We review every case of maternal death in the Commonwealth. And so for us to be able to, we just lost our CDC designee. Okay, that entire division has been obliterated. So we're losing mounds and mounds of critical data. And for me as a researcher, this is what I use to make programmatic decisions. When I get a call from the governor's office, the AG's office, Senator Markey, Liz Miranda, they call me all the time because I'm the research hub, right? This is what we do in my shop. And I have to tell them, right, either the data is unavailable, it's frozen, you have to request it. The request goes unanswered. So what I need now in this moment is a new way of thinking about the collection of data. So what I need now is an influx of funding. The federal government is finished for the research that I'm doing. I think you guys would agree. CDC, NIH, HRSA, all these federal agencies that have funded researchers like me, they're done. They're cooked right now. So we need alternate streams of funding. I'm looking at foundation. I'm looking in the couch cushion to figure
like
out
how much.
Yeah, well, I need $1 million by June 30th. That's like just to keep my doors open and to maintain my staff. And I told my staff, I said, listen, the only thing we're doing this year is trying to keep our doors open and to be able to keep our mission front and center. I do not want us to be watered down. I do not want us to be oppressed. I do not want us to be censored. The only way you can do that is when you bring your own money in. Then the university kind of looks the other way and lets you do what you want to do. When they're funding you, they pull the strings. That's how the game works. So that's what I need.
First of all, I want to thank all of you for the work that you're doing to bring just and equitable care here to Martha's Vineyard and to Massachusetts, because I think we all, working in the state is just something that's really important, because Massachusetts is such a beacon in terms of this kind at this dark time. But also one of the reasons that it's a beacon is because it serves people who are in banned and restricted states, right? And it's one of the few states that can do that. So as the map, we can only serve people who know about us. So the first thing I would say is, if you're going to Texas, if you have family in Texas, if you have family in any state in which there's a ban, we have stickers to put in bathrooms. We have things to put on toll booths. We've got all kinds of things about, to let people know that we exist. And so we're really serious. And Susan's the one that has a lot of materials, that she can send if your child or grandchild is traveling to Louisiana or Alabama, Florida, Georgia, you name it. We'd love to get the word out. So, and that gives us our legitimacy as well, right? I mean, and that's important. And of course, the other thing is I've already talked about, and that is that it takes us $75 to get pills out the door, to cover all of our, the cost of the pills and we subsidized 2/3 of people in order to be able to really receive those pills, right? So our deficit is about $50,000 a month. That has to do with, us in terms of what we need to subsidize, and about half of that we raise through abortion funds. The rest of it we depend on individual donations, some grants that we have and whatever. But, it's just every single pack of pills that we can get into the hands of someone who needs it is just really critical. And we all know that the ability to, control your fertility is kind of central to everything else in your life, right? And so, it really is life-saving in more ways than one.
I need everyone to say the word abortion. I think one of the most powerful things that we can do to try to remove some of the stigma that's been forced upon this healthcare is to talk about it. And it's really meaningful for all of us to become that trusted leader within your own network, within your own community, that people know that they can go to talk about this, and to talk about questions they might have about seeking abortion care, to understand where they can go. I think that's what I need everyone to do. We have a lot of resources that Reproductive Equity Now works to maintain, to help people understand in New England where you can seek trusted care. But similar to what Maureen was saying, I think the more that we talk about it, the more people understand what their options are and who they can go to for help and who they can have trusted conversations with. And so I think that's a really big part, again, of educating our communities and removing some of this stigma that has been imposed on and othered and exceptionalized abortion care for so long. And a huge piece of that is also understanding where people shouldn't go, right? Where is not a trusted provider. And we didn't talk too much today about anti-abortion centers or crisis pregnancy centers, but they outnumber legitimate providers in New England 3-1. And it's really important that people don't go there to seek care because it can be harmful, and they often deploy deceptive practices to ultimately dissuade people from seeking abortion care. So we also have a guidebook. We brought a few copies if people want to take a look, but we have a guidebook on our website all about anti-abortion centers and how to avoid them and instead find trusted care, and also how to educate within your own community about those. So I would say have conversations in your communities about this care and make sure that people know that you're someone that wants to talk about it and welcomes those conversations.